This is a basic overview video on thyroid diseases, just basics over what hypo versus hyperthyroidism look like. So in hypothyroidism, your labs, you're going to see low T4 and or T3 and high TSH. So depending on the disease, there are scenarios when TSH would be low and T4 and T3 would be low if there was a central problem, meaning like something wrong with the pituitary where TSH is produced. But for the most part, T4 and T3 are low, so there's less negative feedback. If there's less negative feedback, your TSH would be elevated because it's trying to tell your thyroid, hey, thyroid, make some thyroid hormone, and it's just not doing that. So symptoms, patient would have fatigue, depression, weight gain, constipation, amongst some other things. So everything's just slowing down, right? Slowing down. So they haven't changed their diet or their activity. Say, hey, I'm not changing my caloric intake. I'm not changing my activity, but I'm gaining weight. And I'm tired all the time. And that can lead to feelings of depression. And things like constipation, just the bowels slow down. And that's hard because when your patient comes in, they're going to have these symptoms. Hey, I'm gaining weight and I'm depressed. Well, everyone's gaining weight and is a little bit depressed, right? They're very non-specific symptoms. So before you jump and give them an SSRI or antidepressant, sometimes it might help to get a thyroid panel, right? Look at their thyroid labs. Maybe they have some hypothyroidism. You replace the thyroid and they feel great, right? So that's a scenario, right? Not always the case. So how do we treat hypothyroidism? Well, thyroid replacement, right? Thyroid replacement. So in all these endocrine diseases we're going to talk about, if someone has insufficiency of a hormone, well, usually we just give them that hormone, right? If they have type 1 diabetes and they have autoimmune destruction of the beta cells, they don't make insulin, well, you give them insulin, right? That's probably the most common example that people would understand. So levothyroxine, that's a generic name for Synthroid, synthetic thyroid hormone. Thyroxine we know is T4, right? Thyroxine refers to T4, or the long name tetraiodothyronine, right? Because it's made of iodine. Liothyronine, so I probably spelled that wrong. That's your T3 basically, so like a synthetic T3. Brand name is Cytomel. And there's something called Armour thyroid. That's like natural thyroid gland ground up, and that usually has T4 and T3 and some other things in it. And an endocrinologist should deal with this and decide what's best for patients. They might not do well in Synthroid, so they might need to try something else. That's beyond the scope of this talk. The most common causes of hypothyroidism is Hashimoto's. There's also euthyroid hypothyroidism. I won't get into all the details there. Now, hyperthyroidism, well, they have high T4 and or T3. So the thyroid gland is making too much thyroid hormone. So when that happens, there's actually going to be more negative feedback on TSH. So TSH in general will be low, right? Because there's more negative feedback. You have to understand negative feedback loops to understand the endocrine system. Symptoms, anxiety. They have weight loss. I haven't changed my diet or my caloric intake and I'm losing weight. This is great. I'm losing weight. Well, you usually don't feel good, right? Because they're anxious. They might have insomnia. They have elevated resting heart rate, right? So they can even have palpitations. They might come to the ER. Heart palpitations. We all have our Apple Watches. My resting heart rate is 110. I don't know what's going on. Am I having a heart attack or an arrhythmia or something like that? It's because of the high thyroid hormone, right? We know thyroid regulates metabolism. Just think of it speeds everything up, speeds all the body processes up. They can have diarrhea, in contrast to constipation here. So how do we treat that? Well, there's some drugs, methimazole and propylthiouracil. These drugs are actually going to decrease thyroid hormones, and those can work to treat these things. Or if there's something like a nodule, like a toxic nodule, always thyroidectomy, so removal of the thyroid. And obviously, you have to understand, if you remove someone's thyroid gland, well, now they technically have hypothyroidism. They're not making thyroid hormone, so they're going to need thyroid replacement therapy with this stuff. Most common cause in the U.S. is Graves' disease, so that's when we also usually have some bulging of the eye. So what's bulging in the eye? If you see my eye, right, you can't see the white of my eye above and below the iris. So if someone's eyes at rest and they're not opening their eyes real wide, if you see the white of the eye above and below the iris, the pigmented part of the eye, that's what we're talking about. Some people call it proptosis. It's a big fancy word. Also things like toxic multinodular goiter. So there's a nodule that forms and it's toxic. It's toxic to your body. Why? Because it's just making way too much thyroid hormone. Okay. So that's just the basics of thyroid disease. That's as much as you would need to know for testing purposes. I hope this helps.